Today's practice is all about releasing and finding space and connecting with your core. The first movement is going to be an IT band release. The second part of the movement is actually a neck and shoulder release. But the focus, you'll realise, will always be the core. If your core is stuck, then this affects the rest of the body. This particular class is going to be like the lazy archer class. So we're just going to do all of the movements on one side of the body. Then we're going to take a moment's awareness. After that moment's awareness, if you've only done one side, you're going to rewind the video and do the second side. If you've done both sides, then you'll move on to the final body scan. So this first movement is an IT band release, which is really good for runners, good for anybody who suffers with hip and knee pain. So your IT band is a thick band of muscle that runs from your knee to your hip. As always, we're going to start with a body scan. You may need a folded blanket underneath your hip or a nice thick carpet. If you're on a thick carpet, you'll be fine. And you may also need another rolled, folded blanket for underneath your head. You may not. Just worth having around, just in case. So bring yourselves down to the floor. Allow your eyelids to close down. And take those first few nice, long, slow, deep breaths. So allowing all of your awareness to move inwards. Letting go of any external distraction. Letting go of any busy thoughts, anything that you might have been doing before this practice, anything that you might need to do afterwards. And just remind yourself that for this next 30, 40 minutes, there's really nowhere else to be, nothing else to do, and no one else matters, only you. So just taking this time to explore and experience yourself from within. The word somatics means mind and body. So just taking a moment right now to notice the quality of your body. To notice any areas of tightness and tension. Any areas of softness and space. It's okay if you're not feeling that much right now. This is all just information. Remember that there's no right, no wrong, no need to change anything at all. As you allow your awareness to move down from the back of your skull, through the back of your body and into your heels. And you just take a moment to notice the weight of each heel into the earth. Maybe one heel's heavier than the other. Maybe they feel the same. That's all fine. Just noticing. Then noticing what you can sense and feel in the arches of your feet, the balls of your feet and your toes. You can feel deep within the bones of your feet, the joints of your ankles, through your calves, your shins and into each knee. Just being curious about the distance between the back of each knee and the floor, noticing, is it the same or is it different? And if it's different, how does this relate to what you can feel in each knee? How does it relate to how each leg has arranged itself? Then allowing your awareness to move on up into the thighs, through the joints of the hips and into your pelvis. Do you take a moment to notice the weight of each side of your pelvis into the earth? just like the heels. Maybe one side's heavier, maybe one side's lighter, maybe they feel the same. And allowing your awareness to move into the sides of the waist. Noticing the distance between the left side of the waist and the floor, and the right side of the waist and the floor. Once again, is this different side to side? And allowing your awareness to move in towards the arch of the spine as you recognize the relationship between the whole of your low back and the floor. And allowing your awareness to move into the ribs, sensing each side of your rib cage as it meets the earth. Noticing what you can sense and feel in each shoulder blade. And then becoming curious about the distance between the top of the shoulders and the floor. And once again, is this different left to right? Allowing your awareness to move down through your arms, past your elbows, through the wrists and into the palms of the hands. As you notice the sensations in the palms of the hands and the tips of the fingers, and the length and weight of each arm into the earth. Then softly moving back up, past the elbows, back to the top of the shoulders. From the top of the shoulders, gently sensing into the curve in the back of your neck, and being curious about the length on either side of your neck. Is one side longer, one side shorter? Is it the same? Has the head fallen one way or another? And then softly scanning the whole of your body, noticing right now which parts of your body meet the earth. And those that don't. So just taking that first before snapshot of you laid right here on the floor. Then when you feel ready, you're going to roll on to whichever side feels best for you. So your knees are going to be bent at 90 degrees. Your head resting on your little pillow, or it could rest on your arm, whatever feels right for you. Just as you lay on your side, I'd like you to notice the breath. So as you breathe in, can you breathe into your center? And as you exhale, can you breathe back out of the center? So if you imagine the breath like a ball of light in the belly, as you inhale, the belly, the back, the ribs expanding outwards. And as you exhale, can you imagine all of that drawing back in? So this breath is going to be the focus throughout this practice. Now, can you lengthen the top leg away from you? Allow it to come down to the floor. As you inhale, I'd like you to flex the foot so your toes are going to draw back towards you and your heel is going to move away, and you're going to lift the top leg just so it's level with the hip. You could pop your hands on the outside of the leg, and as you flex the foot and lift the hip, can you sense these muscles engaging? As you exhale, can you slowly lower the leg back down? Close down your eyes so that you can truly focus on what you can sense and feel. So the inhale flexes the foot, lifts the leg, you reach away with the heel. Can you gently press the side of your thigh into your hand into your thigh, meet the pressure, and then slowly allow the hand to win as you lower your leg back down. Moving as slowly and smoothly as you can. When you come back down, allow that leg to completely relax, completely let go. Take a breath in, a breath out. When you're ready to go again, flexing the foot, lifting the leg, pressing the thigh into the hand into the thigh. Slowly lowering down. So noticing any juddiness, any jerkiness, any loss of control. You can move in and out of these spaces if that helps you. So when you do this practice on your own, move in and out. See if you can smooth this movement out. But each time you come down, remember to completely relax, completely release. So this is the first part of the movement. I always break these movements down. Remember, if something hurts, make the movement smaller. And as we develop the movement, if you feel that you need to stay in the previous movement and not do the full movement, then that's perfectly fine. So for the next part of this movement, you can bring this top hand down to the floor. We're going to lift the leg and flex the foot just like we did before. But now, as the heel reaches away, I'd like you to exhale as you think about contracting into the waist. This is going to draw your hip up towards the ribs. Inhale to lengthen back out, and then exhale to lower slowly. So inhale to lift, flexing the foot. Exhaling, breathing into the core. Inhaling, expanding through the core as the leg reaches away. Exhaling, lowering down. Inhaling, lifting the leg. Foot is flexed, reaching away. Exhaling, contracting into the waist so your hip draws up towards your ribs. As you inhale, breathe into this space to lengthen the waist. Exhale, let the foot come back down. So one more. Inhaling to lift the leg, the foot is flexed, the heel's reaching away. As you exhale, contract into the top side of the waist to draw the hip up towards your ribs. Inhaling back into the space in the waist to lengthen your leg away. Exhaling, foot comes down to floor. Completely release, completely let go. Take 2 or 3 nice, long, soft, deep breaths. Allow your body to reset. Now we're going to take the arm and we're going to bring it out across above the top of the head. We're going to inhale as we lift the leg, and I'd like you to reach away with that top arm. The foot is flexed. And then as you exhale, you're going to bring the arm overhead and you're going to contract into the waist, which is going to lift the head. There's no tension in your neck. All of this movement is coming from the waist. You're bringing your ribs down towards your hips and your hips up towards the ribs. You reach away with the arm. As you inhale, you lengthen back through the top side of the waist. Your arm reaches away, the foot reaches away. And then as you exhale, the arm comes down, the leg comes down. Completely let go. Take a breath in and a breath out. When you're ready to go again, inhaling, lifting the leg, lifting the arm, reaching away, lengthening through the waist. As you exhale, the arm moves up towards the ceiling and then down towards the hip. Your hip moves up towards the ribs, your ribs move down towards the hip, contracting into the side of the waist. As you inhale, lengthening into the side of the waist as the arm comes back over, the leg reaches away. And then as you exhale, letting everything go, allow everything to come down to the floor. Breath in, breath out. So we're going to do 2 more just like this. Inhaling, leg lifts, arm and leg reach in opposite directions. How long can you make the side of the body? Exhaling, arm lifts overhead, points down towards the foot. Hip lifts towards the ribs, ribs lift towards move towards the hips, the head lifts off the floor. If it's too much to lift your head up, that's fine. Remember, we never move into pain. When you come back down, allow everything to reset. One last one. Just doing what feels right for you. Inhale, lift the leg, flex the foot, top arm reaches away. Space down the top side of the body. Exhaling, arm reaches up overhead and then moves down towards the foot. Head lifts, contracting into the top side of the body. Notice that contraction. And then as you inhale, I want you to slowly lengthen. So creating space where you were contracted. And then as you exhale, let everything come down to the floor. Then allow yourself to roll over onto your back. Allow your legs to lengthen out. And we're just going to take a mini moment's awareness here. So remembering that somatic movement is a learning process. It's a process of understanding where your body is holding habitual tension. Bringing awareness to that tension and then allowing it to release and to let go. So taking a moment now to notice the difference between the side of the body that you've worked and the side of the body that you're yet to work. So noticing the length and the weight of what was the top leg. Noticing how that side of the pelvis meets the earth. The length in that side of the waist, what you can sense and feel in that side of the ribs. Then when you're ready, you're going to roll back over onto the same side. So now we're going to bring the movement to the upper body. Your arms are going to come straight out in front of you. If you wish, once again, you could have the arm, your head resting on your arm, whatever feels right for you. So you're going to take an inhale, and as you inhale, your arm is going to reach up towards the ceiling. It's going to open out behind you, and your eyes are going to follow your arm. I want you to keep the shoulder, keep the integration in the shoulder. So don't let the shoulder flop down to the floor when you open out, then you're going to slowly come back. Inhaling to open out. As you inhale, you're breathing into your core. Notice when the center of your body wants to stop moving. So when the center of your body stops moving, the arm stops moving. So you maybe can't see, but my arm is not all of the way down to the floor. The minute that the center of the body stops, the arm stops. So one more, opening out, inhaling into the center of the body, noticing when the center of your body stops moving, that's when the arm stops moving. So the arm right now will not be coming all of the way to the floor. Remember, this is all about awareness, exhaling to come back. So we're going to open out once more. Don't allow the arm to flop. Stop when the center of the body stops. You're going to bring the bottom arm so that your head is resting on the arm. We're going to take an inhale into the belly again. And then as you exhale, I want you to contract into the belly. Sense the muscles of your core. So not just the muscles in the belly, but also the sides of your waist. And then as you exhale, you're going to lift your head and shoulders towards the ceiling. Your nose stays pointing towards the ceiling. So your head, they've got length in the back of the neck. Your chin doesn't tilt towards the hips. As you inhale, you're going to slowly breathe into that space to allow your head to come back down. Allow the shoulders to rest. Notice now on this first movement, your top shoulder may now have reached the floor. Because we contracted into the waist, we then slowly lengthened those muscles, and now the shoulder can reach the floor because the center of the body has moved. It might not have reached the floor, and if this is difficult for you, it may help to put a pillow underneath this top arm. So when you feel ready again, inhaling, exhaling to lift. The movement comes from your core. There should be nothing happening in the back of your neck. The back of the neck should be soft, soft and long. All of this movement coming from this space. Inhaling to lower back down. Take an inhale and an exhale at the bottom. Inhaling into the belly, exhaling into the belly. Engage the muscles of the belly, the waist, the low back, even into the ribs. Lift the head. As you inhale, how slowly can you release the muscles of the center of your body to allow your head and your arms to come back down? Notice each time you come down, does that top shoulder release a little more? Can you release it a little more? Inhaling before you start. Exhaling to lift. Inhaling into that space to lower. So this next part of the movement, you're going to stay laid in this position. Your back arm, so the top arm, is opened out to the side. I'd like you to think about contracting into the front of the chest, so that top shoulder, the shoulder of the open arm, is going to roll towards the ceiling. Allow your arm to spiral with it. You're going to sense contraction into the front of the chest, and you're going to sense your shoulder blade move away on the back body. As you inhale, allow the arm to unwind and the shoulder to come back to the floor. So on the exhale, the shoulder rolls towards the ceiling. You're going to sense contraction into the side of the waist, into the front of the chest. As you inhale, slowly unwinding, allow the shoulder to come back down to the floor. As you exhale, contracting into the front of the chest, allow your chin to tilt backwards. Inhaling to unwind. Now we're going to bring both movements together. So you're going to take an inhale, breathing into the belly, breathing into the back, and then as you exhale, contract everything into the center of the body. Allow that shoulder to roll towards the ceiling as you lift your head and your chest towards the ceiling. As you inhale, inhaling into the space that was contracted, lengthening the muscles that were contracted, and allow your head to come back down and allow your arm to unwind. Remember to take a breath at the bottom to reset. Take an inhale before you start again. Sense the breath move into the center of the body. As you exhale, the breath moves out of the center of the body. All of the muscles in the center of the body contract. Head lifts, arm internally rotates, so your shoulder is moving towards the ceiling. inhaling into that space to open back out. At the bottom, exhale, release, let go. So we're going to do one more. Inhale before you start. Exhale, empty the belly of air, sense all of the muscles contract. Head lifts. Shoulder, top shoulder rolls towards the ceiling. The arm will internally rotate. What's contracting and how slowly can you release this as you breathe in to create space and allow your head to come to the floor, allow your arm to unwind, and then just rest here. Take the bottom arm from underneath the head. Allow both arms to move out to the side. Take a moment's awareness to notice the space in the body. Then we're going to finish on some arc and twist. So with the arms out to your side like a scarecrow, you're going to bring the top leg in front of you. So the top leg is going to be parallel with the bottom arm. We're going to take an inhale. As we inhale, your top arm is going to move up towards the ceiling and over to meet the front hand. And as you do this, that top leg is going to move backwards. The knee is going to hook in underneath the bottom knee, and then you're going to completely flop, completely let go. As you inhale, the top arm, top leg are going to move in opposite directions. So the arm is going to lift up towards the ceiling. As the top leg windmills forwards, you'll end up with the top arm behind you, top leg in front of you. Quite a complicated movement, but once you get used to it, I'd like you to find a sense of ease and space here. The inhale moves the leg and the arm. The exhale lets go. When you come back to being laid on your side, can you allow this top hip to roll forwards? Can you just let everything flop? Then the inhale moves the leg and the arm. Inhaling, the arm lifts up towards the ceiling, comes out behind you, leg scoops beyond the bottom foot and opens out in front of you. Exhale in this position, and then inhale to move. Exhale, let go as you're laid on your side. Inhale to open out, leg comes to the front, arm moves behind you. Exhale here. Inhale to move. Exhale to flop. Inhale to move. Exhale to flop. Inhale one last time to open out. And then from this open position, allow yourself to roll onto your back. You're probably going to be laid in some strange kind of banana type shape. Take a moment here. Resist the wanting to straighten up. And just notice how your body has arranged itself on the floor. Noticing the difference between the side of the body that you've worked and the side of the body that you're yet to work. So what can you feel in the side of the shoulder that you've worked? How does that side of the ribs meet the earth? Length and weight of that arm. What can you feel through the waist, through the pelvis, into the joints of the hips, and the length and the weight of that leg? So just taking a moment to notice the difference left to right. If this is your first side, then go back, do the second side. If this is your second side, if you feel you need to adjust your clothing, do anything to get yourself comfortable, so you might feel that you need to straighten back out, that's fine. Do that. If you're comfy where you are, stay exactly where you are. If you do rearrange yourself, I'd like you to just take a moment, and rather than coming into your habitual laid on the floor pattern, I'd like you to take a moment to think how you just felt, and maybe could your arms and legs be in a different place? Then just allow the breath to settle, allow the mind to settle. Let go of everything that we've just done. Let go of how you think you did, whether you could do it or not. These are new movements, and some of the instruction is a little confusing, so take the time to run back through the video in your own time. You don't need to get it right first time. There really is no right or wrong. All you're doing is exploring your body. So knowing that whatever you did enough. You can come back to this another time. All that matters right now is what you can sense, what you can feel. So just allowing all of that awareness to move in. As you notice now the quality of your body. Noticing which parts of your body meet the earth. Noticing any new sensation, any new awareness. Could be a sense of warmth, sense of tingling. Whatever it is, just let it be. And then following the points of connection with the earth from the back of your skull, all of the way through the back of the body and once more into your heels. As you take a moment to notice the weight of each heel into the earth, to notice what you can sense and feel in each foot, the balls of the feet, arches of the feet, the toes, deep within the bones of the feet, the joints of the ankles. What you can feel in the calves, the shins, the distance between the back of each knee and the floor. Has anything changed? Is anything different? Noticing the weight of the back of each thigh as it moves towards the earth. What you can sense and feel in the joints of the hips. How the pelvis meets the earth, left and right. Distance between the left side of the waist and the floor. And the distance between the right side of the waist and the floor. The relationship between the whole of your low back and the floor. How each side of your rib cage now meets the earth. Any new awareness in the back of the shoulder blades? Can you sense the breath now as it moves into the back of the shoulder blades? Are the shoulder blades releasing into the earth? What can you sense and feel in the tops of your shoulders? What's the distance between the top of each shoulder and the floor? Has anything changed? Is anything different? And then allowing your awareness to move down through your arms, past your elbows, through the wrists and into the palms of the hands. As you notice the sensations in the palms of the hands and the tips of the fingers, and the length and weight of each arm into the earth. And allowing your awareness to move back up, back past the elbows, back to the top of the shoulders. From the top of the shoulders, sensing into the curve in the back of your neck. Noticing the length on either side of your neck and the way that your head has arranged itself on the floor. And then just resting here. Do you take a moment to notice the quality of your breath? Following each effortless inhale and each soft, smooth exhale. As you just allow yourself to float in effortless awareness. Awareness of your breath, your mind and your body resting as one. And just noticing that sense of comfort and ease that this brings. That right now, in this moment, everything is just fine. You are just fine. So just allowing yourself to rest here for as long as you need.